Welcome to the Focus on Falls Prevention Vision Screening video. This video has been developed to be used with the instruction book in your vision screening kit. Vision screening is an important patient safety initiative for preventing falls and fractures in an aging population. While vision screening will not diagnose specific visual deficits such as cataracts or macular degeneration, it will indicate if a person's vision is affecting their activities of daily living. We have proven that people who have been vision screened will have fewer falls and fractures and improved quality of life. Thank you for watching and learning with us.
Visual impairment increases dramatically with each decade of life after 40. Good vision is important to maintain quality of life and independence. In a large proportion of people, poor vision can be corrected with just a new pair of glasses. Often, seniors forget to get their eyes tested for many years, and their glasses no longer fully correct their vision. Sometimes eye disease creeps on insidiously. A person may be unaware of vision loss until it becomes extreme. Many seniors just expect that their vision should be poor, and therefore never have it checked. This simple vision screening test has been designed for use with people of all abilities, including those with speech, cognitive, and motor impairments. It can also be easily used with people who are not fluent with English. People with advanced levels of dementia may have some difficulty with the test, but it should be tried, if at all possible. There are 3 parts to the test: the distance vision test, the pinhole mask test, and the near vision test. The distance test assesses various levels of vision, and the test card can be rotated to provide increased opportunities for test response. The pinhole mask test is used in conjunction with distance testing. The near vision test will help to determine the person's ability to perform activities of daily living. This short video demonstrates the use and interpretation of these tests.
This page isn't as clear as it used to be, but I guess it's a part of growing old.
Well, not necessarily. When was the last time you had your eyes examined?
Oh, I think I had these done about 5 years ago.
Maybe it's time to do it again.
People over the age of 50 should get their eyes tested every 2 years, or more frequently if they notice a change in vision. People who are diabetic, have a history of glaucoma or eye disease, may be instructed to see their eye care specialist more frequently. Vision should always be tested with the person wearing their most current glasses. Distance glasses are often described as TV glasses or driving glasses. They can be single vision, bifocals, or progressives. Near glasses are often described as reading glasses, even though they should be used for all close work activities, including eating. If you are unable to determine the correct glasses from the person's description, ask them to read a piece of newsprint or magazine. Most people will only be able to attempt this with their reading glasses. Ensure the person's glasses are positioned appropriately. Have the person select their distance glasses and clean them if necessary, as this can often make a huge difference. Carefully consider what you are cleaning the glasses with, as some materials will scratch the lenses or remove specially applied coatings. While conducting the vision tests, ensure there is good lighting in the room and make sure you place yourself away from any glare. Any bright light, such as a window, should be behind or beside the person being tested. Minimize distractions, such as turning off the TV. Next, explain the test while you are close to the person.
Okay, I have a card here. I'll get you to put your distance glasses on. And I have a card here with some shapes that look like letter E's. And if you notice, this one's pointing this way, and this one's pointing down. Which way is this one pointing?
That's pointing out.
That's right. And this one?
And that one's pointing up.
Great. So what we'll do now is I'll get it the correct distance.
Okay.
Ensure that the person who is being tested understands what you want them to do. You can describe the E's as pointing in different directions, such as north, south, east, or west. They may describe them as M,
Or what?
It could be an M.
An M.
W,
This one over
E,
here?
and 3. Some people may only be able to point in the correct direction. Whatever description that you agree to use is acceptable, as long as you are sure of what the person is trying to tell you.
That one could be a 3.
A 3, good. Yeah.
Remember, you can rotate the card to confirm that the information is understood. Try to use both verbal and visual cues when you are explaining the test. Demonstrate the test until you are sure the person has understood the procedure. At this point, you need to measure the 10-foot distance. The distance is measured from the back of the chair the person is sitting on to the test card. Experience will allow you to learn this distance by measuring your own paces. Start with the middle size E's or the 2060 set of symbols. Ask the person to identify the direction of each symbol. Encourage the person to point in the direction of the symbol or to tell you the direction. Alternatively, you can use the matching card to point to.
Okay, so let's try this size, the middle set. What direction is this one pointing?
And that one goes to the left.
Perfect. And
Hold the
there?
card at the tester's waist level, as this helps to ensure the person is looking through the correct portion of their glasses. This is especially important if the person is wearing progressive or bifocal lenses.
That's down. I'm not
Just try.
sure. I'm not sure.
Use
of
a
that.
little encouragement.
Let's try it this
Sometimes
way. How
people
about
will
this
say they can't see the symbol because it's a bit blurry. This can be remedied by instructing the person to blink a few times and then repeat the test. If the person correctly identifies 3 out of 4 E's, then this represents 20/60 vision. You can then proceed to the smaller set of E's representing 20/40. If they achieve 20/40, the distance part of the test is complete. 20/40 is considered normal for a senior. In this case, the person could not identify 3 out of 4 E's correctly on the 2060 test card, so we'll move to the larger 2200 test card at 10 feet.
Let's try a larger size then. Let's try this one here at the bottom.
Well, that goes to the left.
Good for you. This one?
To the right.
Good.
That goes up.
Perfect. And this one?
That is down.
Good.
You have now assessed the person's vision to be 2200, and you must record appropriately. If they are still unable to identify 3 of the 4 E's at 10 feet, move closer to the person, to 5 feet from the back of the chair to the test card. Then repeat the distance test using the 2200 E's. If the person is able to identify 3 of the 4 E's, their vision is recorded as 2400. If they remain unable to correctly identify 3 of the 4 E's, their vision should be recorded as less than 2400. When in doubt, always refer to the instructional booklet for clarification. This test result is well below normal vision, so we now test with the pinhole mask. This works to reduce the amount of optical interference and to focus light on the retina. You use this for anyone who cannot see the 20/40 set of symbols correctly.
So I'm going to get you to look through the holes in this funny-looking mask. I'm going to get you to hold it up at the bridge of your nose, right in front of your glasses. Perfect.
When you use the pinhole mask, you always test with the size harder or smaller to determine if the pinhole mask helps or not. It is very important to remember that the original test result does not change. Record appropriately. You will need this information when you refer to the algorithm to determine which type of referral is necessary.
Oh, these are great. Maybe I should keep these.
Well, maybe you should just get your eyes tested again and get a new pair of glasses. Let's try the smaller set of symbols.
Try the pinhole mask with the set of symbols of the size harder or smaller than the person could previously identify. Again, they need to identify 3 out of 4 E's correctly to determine if the pinhole mask helped or not. Don't forget, you can rotate the test card to gain additional confirmation if you are unsure. If the level of vision improves with the pinhole test, it is most likely that they will need to see an optometrist to see if new glasses will help. However, if there is no improvement or the vision deteriorates using the pinhole test, you should inform them or their medical practitioner of the vision assessment so that the appropriate referral is made. If you try this yourself and you have normal vision, your vision may appear to be worse with the pinhole test. It will only improve if you have a refractive error of vision such as nearsightedness, farsightedness, or astigmatism.
Well, we're doing great so far. Can you get your reading glasses for me?
Oh, if I can see where I left them. In just a minute. I think my collection is down here. I've got numerous sets. Looking for different ones. I think these are the last ones.
Do you do much reading?
Well, I used to, but my eyes tire so rapidly now.
Okay, we'll try your reading vision now. Can you put on those glasses for me?
People often keep all the glasses they have ever been prescribed and then get confused as to which ones they should be using. However, they will usually select the ones they can see best with. Old glasses can be donated to various community agencies. It's a good idea to advise the person to dispose of all old glasses, or at least put them in a cupboard to reduce confusion. Now, let's move on to the near vision test. Ensure there is appropriate lighting. Have the person sit next to a window and switch on a lamp. Ensure their glasses are clean. Seniors need more light than younger persons simply due to the normal changes that happen as we age.
So can you tell me the direction of this one?
Goes to the right.
And this one is?
That one goes up.
And then this one?
To the left.
And this one?
And that one's down.
Good, good. Let's try these ones.
Oh, they're too small.
They're too small?
Don't try to force the person to see something they can't. But remember that a little bit of encouragement often reveals a slightly better response than the initial reaction. In the same way as before, if they can see the middle line, N20, proceed to the smaller one, N8. If they can't see 3 out of 4 E's of the middle line, move to the larger symbols.
Those are...
Record the line of symbols that can be correctly identified.
That's to the right, and that's up.
So today we did a simple vision screening with you, and I suggest that you get a full eye examination. The test does indicate that your vision may well be improved by a new pair of glasses.
Thank you.
You're welcome.
People may be advised to visit their optometrist or ophthalmologist if they have one. If they don't have an ophthalmologist, they should be advised to see either their general practitioner or an optometrist. Remember, these tests are a screening tool to determine potential loss of vision due to probable eye disease. If you have any doubts, always refer. Although everyone over 50 should have their eyes checked every 2 years, there are some people at special risk, such as those with diabetes and those with a family history of glaucoma. It is essential that every person with diabetes have their eyes checked as soon as they are diagnosed, and then at least every year. With diabetes, changes within the eye go unnoticed, so you may need to educate people with diabetes or their caregiver about the need for annual assessments. People with a family history of glaucoma are at risk and should have their eyes checked regularly after the age of 40.
Thanks again for learning with us. Remember, vision screening does not replace a full eye examination by an optometrist or an ophthalmologist. If you ever have concerns during the vision screening process, always refer people to an optometrist or an ophthalmologist. We welcome any questions you may have, so please phone or email us at any time. On behalf of Misericordia Health Centre and Manitoba Health, thank you for your interest in the Focus on Falls Prevention Project.